Okay.
It's not something that's automatic. I say getting a cochlear implant is like learning a new language. You don't learn French overnight. You have to listen to French, you have to immerse yourself in it. And it's the same thing with hearing aids and cochlear implants. You have to wear your device to be able to benefit from it.
Welcome to the Hearing Wellness Journey podcast, an exploration of determination, hope, self-discovery, and triumph. We'll share the personal experiences of those that are living with hearing loss and provide a haven for their stories to show others that they are not alone in this journey. Please welcome your hosts, Dr. Dawn Heiman and Lindsey Doherty.
Welcome to today's episode of the Hearing Wellness Journey podcast. I'm Lindsey Doherty, and I will be your host. I am super excited to introduce Tina Childress, an audiologist and advocate who has an amazing story that I'm excited she's willing to share. So welcome, Tina.
Thank you for having me, Lindsey, on the podcast.
We are so thrilled because you can shine so much light on so many topics.
I'll do my best.
Well, really, tell me how your story began.
Oh boy. So my story began in the year of our Lord in the late 80s when I went to college and I was an engineering major. I actually went to the University of Illinois, which is where I still live. It's like a black hole. And so I lasted about 2 years, and understand back in the 80s, there wasn't a lot of support for women in engineering. And so I didn't feel any kind of passion, and I decided, you know what, I'm going to take an elective that has nothing to do with engineering, and that elective was a sign language class. So the sign language class introduced me into this weird building that time for called the Speech and Hearing Science Building. And there I learned about this field called communication disorders. I had no idea that this was something that even existed. So I took this class, and then I started finding out about these classes, and then eventually I switched my major. When you're an undergrad, you take classes in both speech pathology and audiology, and then afterwards you have to choose one or the other. Understand this was kind of way back when we didn't really have the AUD yet. I think I was one of the last classes before our program switched over to all AUD. So I chose to become an audiologist. And so that sign language class really kind of set the foundation for a lot of different things. Not only did it introduce me to the field, but I ended up teaching that class when I was a grad student. I used it with my family. Both my girls have grown up using sign language. I finished my degree, and I always knew that I wanted to work with children. I think part of it was like way back then, when my hair was still like dark. People did not, and not what I call COVID ombre, which is what I'm calling it now. But back then, there's a lot of engineers. You guys all know what it's like. If you get a musician or if you get an engineer as a patient, you're like, okay, they're going to ask me a lot of questions. But when I was a student, so many of them were like, oh, you're so cute. You remind me of my granddaughter. And I'd be like, I really know a lot about hearing aids. Let me help you. And so I thought, you know what? I think I want to work with kids. And I loved every rotation and internship that I had with pediatrics. And when I graduated, I was really fortunate to be able to go straight into educational audiology, where I work with kids and do audiology and work in the schools. I'm realizing over the past, couple of decades that I've been in the field that I really am a teacher at heart. And so this marriage of audiology and education has been a really perfect fit for me. So I graduated, started at my job, and about 9 months later, I was testing a kid in the booth. There's 2 of us in our office, luckily, and so I was on the side with the child to keep the child focused, and then my coworker was on the other side giving the beeps and all of that. So my job was to keep the kid focused. So the child would listen for the beeps, and when they heard the beep, they would put the toy in the bucket. I'd be like, good job. Well, then the child started putting the toy in the bucket. I'm like, wait, you have to listen. And the kid looks at me and it's like, hey, lady, I hear the beeps. And I thought, ooh, that's weird. The kid would not wear headphones, so we were doing the sound through speakers. So I could hear the louder sounds, but then when it got really soft, I was assuming that the kid was just putting the toy in the bucket, but it was more I wasn't hearing it.
Wow.
So the kid left, and I asked my coworker to test my hearing. And at that time, I had it's called a mild to moderate hearing loss. And to give you a sense of what a mild to moderate hearing loss is like, just take your fingers and plug up your ears and just continue listening for a few seconds. That's a really quick and easy way to kind of sense what it's like. You can hear things, but you have to work harder. You may notice if you close your eyes that it's harder to understand and things like that. So that was in the morning. That afternoon, I was really lucky to be able to get into the clinical audiologist's office at a local clinic, and they tested my hearing, and I had this weird mild to moderate hearing loss. It wasn't because of ear infection or anything like that. It was sensory. We knew it was past the level of my eardrums. We kind of waited it out, and then my hearing was changing. And so over the next few months, there were a lot of fluctuations. There was a lot of progression. I was on steroids, the whole thing. So this happened in March. By November, I had complete hearing loss. And so that was really hard. It was making my job harder. I realized how much I relied on lip reading. This is where the sign language comes into play. People that are around me, people that I work with, my family, they were able to sign with me. I relied on it. At the time, this is a long time ago, back when we still had analog hearing aids. And so, I was struggling quite a bit. But I guess it was meant to be. So my diagnosis was eventually autoimmune inner ear disease. So I had a fever over spring break. It was a high fever that lasted for a few days. We think that whatever caused that really high fever just kind of kept going. And of all things, it attacked my ears. So I realized how much it was impacting my job, how much it was impacting my family. There's no history of hearing loss anywhere in my family, so we don't know kind of where this came from. I started out with hearing aids when I realized that I was really, really struggling. Mm-hmm. Being an audiologist and knowing of having hearing aids was definitely, something I think that added to my urgency, that I really wanted to be able to hear better to help with communication. So I wore hearing aids from probably about that summer until November, when I was completely deaf. And then another 9 months later of wearing hearing aids and really, really struggling, I decided, after doing a hearing test, that when I realized that I got like 0% or 4% right when we were doing testing with sentences, and my ear, nose, and throat doctor said, it's time. And I'm like, okay. And it was funny because he's flipping through his schedule book. He's like, oh, we have a cancellation tomorrow. I'm like, I'm not like psychologically ready for tomorrow. Let's wait. And so we had it the next week. So we're going now. My cochlear implant, I guess, in August will legally be an adult. It'll be 21. So my first side is from August of 2000, and I went bilateral in December of 2005. So, I did the whole thing. I had, like the smaller in the ear hearing aids, and I went to the big chunky hearing aids, and then I had one implant with a hearing aid, and then I had two implants. And so I've had like every possible kind of hearing loss configuration that you can think of. So.
Wow, you really have. I mean, and in a short period of time.
Yeah, it was fast. In like 9 months, becoming completely deaf.
Right. And then, I mean, I know you said that you were overwhelmed when your doctor was like, how about tomorrow? And then you're like, no, I need to, wait a minute. I'm not psychologically there. And then the next week you were ready. Mm-hmm. Was it easier to possibly do that because you'd you are in the industry and you do understand the next steps. And so maybe is it easier to cope with that?
There's something to knowing too much, I think sometimes too. I think early on in my progression, I was actually part of a drug study looking at the efficacy of using something other than an oral steroid. But I got kicked out because my hearing loss kept getting worse. But that doctor told me kind of pretty early on, he said that, with the way that my hearing loss was progressing, that I was probably going to be a cochlear implant candidate. And I was not mentally prepared for that. I mean, he probably just said that to me in like June. And so I was really surprised that that was coming down the road. But at the same time, it was kind of nice because I could prepare. I
Yeah.
wasn't prepared for like the day after, the doctor opened up the book for the scheduling. But I think I knew down the line, especially when I realized how much I was struggling, that I was going to be a candidate. I did not hesitate about getting hearing aids, though. Those were very easily accessible to me. And when I recognized how much I was struggling in just everyday communication, as well as doing my job, then, I didn't wait. I know that most people wait a long time before they seek any kind of help or to even acknowledge that they have hearing loss. I knew I had hearing loss, so that hurdle, I think, was something that makes it go faster. Like if you know what your hearing levels are, or if you recognize that your hearing is changing, I think you're more perhaps likely to pursue additional help if you are struggling more. But if you're kind of in that phase where you haven't had a hearing test for a long time, and it's kind of like one of these where you're like, I don't want to look and I want to see, then if you don't get a hearing test and you don't know where you are, then it's harder to make that leap. So I feel like, when I talk to people and they're like, well, I'm not sure if I should get hearing aids or not, my first question is, have you had a hearing test? Do you know what your hearing levels are? Do you know what your scores are, your ability to understand words or sentences? To me, that score is more important than what your hearing loss looks like on an audiogram. Because you can have two audiograms that look exactly the same, but people are going to function so completely differently. And so, my parents are of that age where they both have hearing aids now, and definitely having an audiologist daughter kind of pushed them to be more comfortable with it. And it's funny because then they bring their friends over and we have like this whole like seminar about, about getting hearing aids and good communication strategies because no one like listens to each other. It's really funny. Um, but those are the kinds of things that I knew. And then even just getting my cochlear implant, I also knew that it was going to take work. It's not something that's automatic. I say getting a cochlear implant is like learning a new language. You don't learn French overnight. You have to listen to French, you have to immerse yourself in it. And it's the same thing with hearing aids and cochlear implants. You have to wear your device to be able to benefit from it. If you're only wearing your hearing aid or cochlear implant an hour a day or 2 hours a day, you're not going to become fluent in listening through your hearing aid or cochlear implant. Your brain is not going to bond with it, and you're just going to hear sounds that are louder, and you won't know what it is because you haven't been practicing.
Love that comparison there because so many people can understand that, having had to take foreign languages in schools, you're able to say, yeah, that makes complete sense. I can't just jump into it and be fluent, as you said, be, really skilled and exceptional at this. It takes work.
It does. And there's no like formula or there's no way to predict when that like switch turns on and all of a sudden you're like, oh, now I get it. Now I'm fluent. I think people that have had hearing loss for a long time take a little bit longer to get used to hearing again and rewiring their brain for those sounds. I have heard of people that have lost their hearing overnight and then they get a cochlear implant rather quickly and they do fantastic, and of course some also struggle. I think that people need to understand that there are so many factors that go into a well-fit hearing aid or a cochlear implant that is properly programmed. It's not always just you. It's not always just the audiologist. I mean, there's all of these things that come into play, your auditory memory, how long you wear your device, how long you've been deaf or hard of hearing. I mean, all of these things can make a huge difference.
Now, was it kind of a similar response with your brain or psychologically even after the second implant as with the first, or were they completely unique experiences?
I would say that they were unique. When you qualify for a cochlear implant, you're kind of like bottom of the barrel in terms of hearing. And so I went very poor hearing with my hearing aid to all of a sudden hearing these soft sounds I hadn't heard in a year with my cochlear implant. Now, I couldn't understand what all of those sounds were in the beginning, but I remember walking out of my audiologist's office and being able to hear the zipper on my coat again. Oh my gosh, flushing the toilet was the worst ever. It's terrifying. And so, yeah, when you haven't heard it for a long time, for me, I think because I lost my hearing rather quickly and I got implanted rather quickly. I mean, all told, everything happened within 18 months from noticing I had hearing loss to becoming deaf to getting my first cochlear implant. But I practiced really hard. Now, understand, back in 2000, we barely had the internet. So, everything was like audio cassette. I would have to go to the library, and the binder that had all of the audio cassettes was like super, super like huge and chunky. But that was kind of my auditory training, my family reading the newspaper to me, and just having conversations with and without lip reading cues in a variety of environments was really what kind of set the tone for how I would do oral rehab. I got my second one 5 years later. And the reason I didn't get them both at the same time is they weren't doing bilateral cochlear implants back in 2000. So I was probably one of the first at my clinic. And the thing about getting a second cochlear implant is that if you are doing really well with your first implant like I was, it's really hard to notice the difference. Because you go from nothing all of a sudden to doing amazing. And then you get the second implant and you're like, why isn't it as amazing? But it's the subtler things. It's things like realizing, oh, you know what? I am hearing better in background noise. Oh, now I know where my kid is. When I had my first cochlear implant, one of the things that's really, really hard, it's like being deaf in one ear. So I could hear on one side and I was completely deaf on this side. So I could not localize or figure out where my kid was in space. I had a toddler and I just wanted to stick one of those like orange flags in her diaper because she'd be like, Mom, Mom. And I'm like running all over the house trying to figure out where eventually she learned how to say, Mom, I'm in the kitchen, or Mom, I'm in your room, which was very helpful. But with my second implant and my second kid, I was able to localize. So that was something that was really good. The other thing is, I remember my first child, if I would hold her and she was trying to talk to me and I wasn't listening, she would take my face and put it to her because she recognized that I needed to see her face.
Oh
Yeah.
my God.
And my second kid, I didn't have to worry about that, even if she was on this, because both sides now were implanted. So, it's really hard. And then also like forcing myself to take off my first implant and practice with my second one, that's always going to be really, really hard for people that are getting a second one, but it makes such a huge difference in terms of your progress. You may not realize it, but it does. And a lot of people say, oh, I'm not seeing that much progress. It's because they're relying so much on their first side.
Wow. Is that something that is counseled in your appointment? Hey, you're going to have to take off your first in order to strengthen your second.
And I know with some of the kids, the audiologist actually tells the parents, take off that first side for like a week. Or, we have to be careful though, because the kids are also responsible for academics and being in school. We don't want them to be overly fatigued. So, there are exceptions like, okay, you can wear both in school, but when you're home, definitely make it a point to take off that first side and really concentrate on kind of building up that auditory memory and the synapses on that new side so that, you can benefit from both. Our teachers of the deaf and hard of hearing will do practice with one versus the other with both of them together.
That's super awesome piece of information that I think many people wouldn't know or think about, but it makes complete sense. Because otherwise you'll just rely, as we do in any type of injury to our body, you twist your ankle on the left side. So then you make up for it on the right. You don't end up getting the full mobility back for a while then, because you're sort of babying it,
Right.
or just letting it kind of be carried along.
Yeah, yeah. And so it's more, when you get that second side, it's more like a quality of life improvement. You may not notice right away the audiological improvement. When I first got my second implant and then we started doing testing, I always did better with, understanding words and phrases when I had both on, especially in background noise. So our brain needs to get the signal from both sides in order to process the noise. And so because I was kind of uneven, having nothing on this side for like 3 years, it makes a big difference.
Oh my gosh. Now tell me what you have going on professionally.
Oh gosh.
You don't mind sharing, because I've been doing some research myself on you, and I love how you are this advocate, and what you put out there is so important and empowering. And so I want you to share it with everybody.
Thank you. By day, I am an educational audiologist half-time. So I work, in the mainstream school settings, doing hearing assessments, making sure kids have the equipment that they need for school and they have access, interfacing with teachers, things like that. The other part of my day job, half-time, is working for our state school for the deaf as an outreach trainer. So I train teachers and parents and do in-services for schools and things like that. I love that. And then on the side, I kind of do a lot of different things. I've done some adjunct instructing here at the U of I, and I'm also doing some teaching right now at University of Memphis. But I think people know me also as this person who likes to create lists, to the point where I have a list of my lists. So I feel like, all of this happened for a reason. Going into the field, learning sign language, becoming deaf, getting cochlear implants, I really do a lot of code switching where I go amongst different identities depending on where I am and who I'm with. And so one of the things that's kind of my passion is taking like all of this kind of information that deals with audiology and making it relevant and understandable for consumers. So like my peers that are deaf or hard of hearing. And then I feel like when I am with my peers, my professional peers like audiologists, I hope that you guys understand where we as consumers are coming from. So I have this kind of dual perspective where I'm trying to kind of be like this bridge between both groups. And what's so cool is that 20 years ago when I started in the field, there were not that many deaf or hard of hearing audiologists. But you know what? Now there are many, many more, to the point where we have roundtables at our annual audiology conference. We're Facebook official. We're a subgroup for medical professionals with hearing loss. And, we recognize what our value is. And I'm not saying that audiologists that don't have hearing loss are completely worthless. That's not what I'm saying. But what I'm saying is that group, we're really strong advocates and very passionate about what we do because we understand what it's like, living it every day. Most of us really love like assistive technology. That's my jam. I have all the things. If there's a new gadget, that's out there, or app, or, like a new kind of accessibility option on something, I want to learn about it and I want to help teach it to people, because so many things have been happening even in the past 20 years since I was in school. 20 years ago, we didn't have Bluetooth. We barely had Wi-Fi, and now audiologists are having to understand not just the hearing technology, but all of these like Bluetooth things with the streamers and the connectivity. And then even the consumers are having to understand this. And I think it's really hard. When we think about who the patients are that are getting hearing aids or cochlear implants, they're older people. So I'm thinking very specifically of my parents who I love, they kind of like technology, but it gets them in trouble because they get easily confused.
Mm-hmm.
My dad just got a new car, and it took us a day to figure out how to pair his garage remote control with the button in his car. And it's not simple anymore. There's not even an option to be simple anymore. And so I feel like older adults that did not grow up with this technology, I'm talking maybe people in their late 70s, early 80s, there are some that are really, really savvy, but I understand that it's not natural to you. I mean, I'm in my 50s, understanding some of this stuff, sometimes I have to ask my kids. I really know technology, but there are still times when I don't know how to do something and I have to ask my kids. And so I feel like I get why some older adults just want to keep it simple. They don't want to have Bluetooth. They just want to be able to hear and
Mm-hmm.
communicate. And that's okay. We got to work with what we have.
I do feel that, try and be in somebody else's shoes, but you were saying being an audiologist who is in those shoes, you have a different form of empathy and understanding that other audiologists who don't have any hearing difficulties, not to say that you have a leg up on people, but it's completely unique
Yeah.
thing. And almost it creates this bond, I feel, between patient and provider.
I've loved that bond when I work with kids and they're like, oh, you can be like a role model. Like, wow. Like some of our kids where I live, they're the only deaf or hard of hearing student in their entire school. And to see an adult that is deaf or hard of hearing is a huge thing. And
Mm-hmm.
so we were talking about resources. So I do have kind of I call it my blog site. I kind of blog, but it's also kind of a website. So if you just go to tinachildressaud.com, you'll see some information that I've posted on there. You will see how to access my list of my lists. And that's part of it too. Like I'm always thinking about, we have all of these different options and features for accessibility when it comes to like captioning and things like that. But it's so confusing. People don't know what they don't know. And so I'm always trying to figure out a way to make it understandable. So I have like these lists and charts where you can see, okay, this is the device I have. This is the captioning option that I can use. I need to get more active with finishing up my YouTube videos showing how to demonstrate some of these things. I have a few that are up there. For the longest time, I felt this need to just kind of create these things to share with people. My first list ever was talking about apps. And so I created this list of apps that work for people that are deaf or hard of hearing. It was focused more on kids because I do pediatrics, but then I recognized how much the adults could benefit from it too. And then I had to create a second list for Android devices because it
Yes.
started out with iOS. And I'm happy to do that. I feel like it's my talent or my gift. And I'm always happy to share that information. So
That is so wonderful. We are definitely going to provide a link to that page as well so that everybody will have easy access to it because that's the point of the podcast. We want to empower people with knowledge, professional and consumer, and those with hearing loss, and those who might know somebody with hearing loss. They could even use these stories to benefit their relationships, their communication abilities, and add to the strategies of having better communication. It's really a wonderful tool that you're providing everybody. I love it.
awesome. I'm glad you found it.
So, Tina, if we had to go with one takeaway from your story, your experience, what would you want that to be for our listeners?
Wow. I don't know if I have one. I have a couple, I think. One, it doesn't happen overnight. My friend said about something else, there are no shortcuts. So when it comes to being able to communicate better, to be able to hear your family and friends better, understand that there is a process and you want to go with someone that does best practices so that you are not having to redo it because you decided that you wanted to go with subpar kind of services. I understand that cost can be an issue sometimes, but you also get what you pay for. I'm not just saying this because I'm an audiologist, but I truly believe that it's not just about the device that you hold in your hand that you put in the ear. You are going to be successful based on what you do after that. What do you have in the form of oral rehabilitation? Learning how to use the device that's in your ear, because it's not automatic. I think that's huge. The other thing is don't be discouraged if you think that you're not making progress as fast as you want. It's easy to want to compare yourself to someone else and be like, well, why are they doing so well with their device and I'm still really, really struggling? There are so many factors that you may not know about. And so what I like to do is I compare myself to myself. I remember back when I was learning how to hear, rather than looking at some of my friends who were doing amazing with their devices, I just focused on my little chart and I watched my own numbers go up and up and up when I was doing my own kind of listening therapy. And just seek help. My third one is if you are a consumer, please connect with other people that are deaf or hard of hearing. As an audiologist, as a late deaf and adult, as a someone that uses sign language, all of that, I have kind of my wheelhouse of things, but I'm not a parent of children that have hearing loss. I like to call them hard of listening, but that's a totally different story. I love to connect parents with other parents that have been through things. And as an adult, you know what? It's so empowering to go to these consumer conferences and learn about different technologies and learn from your peers that are deaf or hard of hearing. I guess I should say I'm also really active on different advocacy kind of groups. I'm on a few different boards and committees and things like that. And that has been huge for me. Not only do I feel great because I'm helping to educate them about things and give back to these groups that have helped me over the years, but I keep learning also. I go to these conferences and I'd be like, wow, that is a really cool gadget, or I had no idea that this was an issue. So there are groups like ALDA, which is the Association of Late Deaf and Adults. There's groups like HLAA, the Hearing Loss Association of America. There's NED, the National Association for the Deaf. There's E.G. Bell, Alexander Graham Bell organization, and Hands and Voices is my favorite resource group for parents of kids that are deaf or hard of hearing. I mean, my list can go on and on and on, but my point is if you've never chatted or talked with another peer, adult or kid that has hearing loss, it's you guys both get it. I love that feeling of when I go to these groups, like I don't have to remind them, please look at me, or let's go someplace quiet, or let's go someplace with good lighting. None of us ever say to each other, ever, oh, never mind, I'll tell you later. Those are the kinds of things that we experience when we're, out and about with people that have normal hearing. With masks, social distancing, it's been a struggle for everybody, especially us that rely on lip reading, but even the hearing people are recognizing that it's harder to hear. They have to work harder. So I guess those would be kind of my 3 takeaways. I hope that helps.
Thank you so much. I hope many people get to listen to and take notes, because you have provided a lot for both how to think about things, resources. Your own journey has just been so unique, so different, I think, and you've just accepted it or jumped into it with this sort of gracefulness, and you're just exuding passion and you want to share with people and really just inform everybody. Knowledge is power, and we can make better choices, better decisions, think about the big picture, and you have provided so much of that today. Thank you.
You're welcome. Thank you for having me.
Thank you for joining us on this episode of the Hearing Wellness Journey podcast. For more information about what we do and the services we provide, please visit our website at hearingwellnessjourney.com/podcast, where you can find more resources based on today's discussion, as well as request to be a member of our Hearing Wellness Journey community on Facebook. That's available for our listeners exclusively on hearingwellnessjourney.com/podcast.